Dr. Devonna Beard, and today we're going to discuss high cholesterol. High cholesterol comes from two places, either from your genes, that means from your family history, or it comes from your what you eat. People who are overweight or obese have a higher rate of high cholesterol. Of course, weight loss helps to decrease your cholesterol levels. There are many things that can occur if you continue to have high and uncontrolled cholesterol. These include strokes and heart attacks, kidney failure. Cholesterol affects these different organ systems because you have plaques that build up on the arteries, which can lead to strokes and heart attacks and so forth. So it's very important that you control these numbers. In order to control them, you need to know what your numbers are. First of all, the first number is your triglycerides. Your triglycerides should be less than 150. Triglycerides are the fats, the free fats that roam in your blood. Should be less than 150. The next number is your HDL, which is your good cholesterol. Your good cholesterol is the only one that should be high. Good cholesterol should be greater than 40. Greater than 50 is best. The next number is your LDL. Your LDL is your bad cholesterol. That should be as low as you can get it. If you don't have any risk factors, your LDL can be between 130 and 160. If you do have risk factors, your blood cholesterol can be less than 130 as an optimal level. What can you do to decrease your cholesterol? First of all, as I said earlier, you should strive to lose weight. Your weight, it really influences what your cholesterol levels are. Secondly, you should watch what you eat. Decrease the things in your diet that have high saturated fats, such as eggs, red meats, breads, and cookies. Sometimes those things are made with lard. Those things really influence what your blood cholesterol is, and you should really eliminate them from your diet and use substitutes. You should strive towards eating fish and poultry, and more fresh fruits and vegetables. And foods that are high in fiber also decrease your bad cholesterol and increase your good cholesterol. And also, exercise influences your cholesterol. The more you exercise, the better your cholesterol levels are. This has been Dr. Devonna Beard for your Health Minute. I'm Dr. Devonna Beard, and I'm going to be discussing high blood pressure with you. Another name for high blood pressure is hypertension. This is probably what your physician will call it, hypertension. Hypertension is associated with strokes, with kidney failure, with heart attacks. If your blood pressure is uncontrolled, it will easily lead to these diseases. It is a major cause of death in the Black community, and disproportionately affects us because we don't go to the doctor as much, and also because it is uncontrolled. Hypertension is linked to obesity, to our family histories, and also to the lack of exercise. The most important thing for you to know is your numbers. If you have high blood pressure, or if you have a family history of high blood pressure, then you should have a blood pressure cuff, and you should monitor your blood pressure regularly. Your blood pressure should be less than or equal to 140 on the top number, and 90 or less than or equal to 90 for the bottom number. If you're close to these numbers, then you probably have pre-hypertension. Pre-hypertension is a warning signal. It means that you need to lose weight, you need to start exercising, and you need to just change your lifestyle. If you've already been diagnosed with high blood pressure or hypertension, you should make sure that you monitor your blood pressure at least once a week and that you're compliant with taking your medications. If you find that your blood pressure runs higher than 140 over 90, then you should discuss this with your physician so there can be some changes can be made with your blood pressure medications. How can you reduce your blood pressure even if you do have a diagnosis of hypertension? First thing you can do is to change your eating habits. You can decrease the salt in your diet. You can decrease the fat in your diet. You can increase magnesium, foods with magnesium and potassium in your diet. Secondly, you can lose weight. We can all Usually all of us can spare to lose 5 to 10 pounds. 5 to 10 pounds can make a dramatic improvement in your blood pressure. You can also exercise even without weight loss. Exercise without weight loss also decreases your blood pressure by 5 to 10%. So this is Dr. Devonna Beard, and this has been your Health Minute. Hello, I'm Dr. Devonna Beard, and today we're going to be discussing diabetes, mainly type 2 diabetes. Type 2 diabetes is a common disease that plagues the Black community. Almost all of us know someone who has diabetes, either a family member or a friend. Diabetes is closely linked to family history, as I discussed, but it's also linked to obesity. If you're overweight or obese, which is a BMI greater than 30, you have many times more propensity to develop type 2 diabetes. Type 2 diabetes is considered an equivalent to coronary artery disease or heart disease. That means if you have diabetes already, they consider you to already have heart disease. And that means your risk of having a heart attack is just the same as someone who has already had a heart attack. In saying this, it's very important that you keep track of 3 sets of numbers, 3 types of numbers. The first one is your blood sugar. Your blood sugar should stay between 100 and 120 in the morning. That's fasting when you first get up. And then 2 hours after your largest meal, your blood sugar should be no more than 140. If your blood sugars are greater than this, you should see your physician to have an adjustment in your medications. The next numbers are your blood pressure. Your blood pressure should be less than 120/70. That's optimal blood pressure for a diabetic. Someone who's not diabetic can tolerate a higher blood pressure, but you being a diabetic, you're already considered to have coronary artery disease, so your blood pressure should be below. The next set of numbers are your cholesterol numbers. The first number in that set is the triglycerides. The triglycerides are the fats that are in your blood that are stored as fat. You get these from different types of food that you eat, mostly. So to decrease your triglycerides, you want to change your diet, decrease the fats in your diet, to decrease cookies, decrease crackers, and fried foods, things that have a lot of fat in them, or saturated fats. The next number would be your LDL, which is your bad cholesterol. I consider your LDL as pickup trucks. They leave your liver and they go around to your arteries, like around in your brain and in your heart, and they dump off cholesterol, causing plaques, which can eventually lead to heart attacks and strokes. So to decrease your LDL, you also need to change your diet and exercise, decrease the fats in your diet and saturated fats. The next number is your HDL, which is your good cholesterol. This is the only number in this set that needs to be high. The optimal number for your HDL is greater than 40, closer to 50 is better. The HDL is like a pickup truck. It goes around to those arteries where the plaques are, and it picks up cholesterol so that you have less plaques. And I failed to mention that the optimal number for your LDL is 100 or less, and the optimal number for your triglycerides is 150 or less. So most of the symptoms of diabetes and the high numbers can be corrected through lifestyle changes. And we as Christians should be able to use self-control that the Holy Spirit gives us to lead healthier lifestyles. Galatians 5:23 says that we all have self-control through the Holy Spirit. So instead of asking God to heal us of every disease, we have to make lifestyle changes first so that God can come in and give us a supernatural healing. So this concludes our Health Minute. This is Dr. Devonna Beard.